Vitamins are a distinct set of essential organic micronutrients that are necessary in our diet for best nutrition and prevention of deficiency syndromes, but are not synthesized in our bodies, and therefore must be provided from an exogenous source. Along with this knowledge, we have thought that vitamins are reasonably harmless, and mega doses of such can prevent or improve the effects of different health conditions, leading to the potential for misuse and toxicity. This video is intended to inform you on the different vitamins that are associated with significant adverse effects when taken in very large doses. Vitamins can be divided into two general classes, the water-soluble and the fat-soluble vitamins. Water-soluble vitamins, including the vitamin B and C complexes, have minimal toxicity solely because they are stored to only a limited extent in our bodies. On the other hand, the fat-soluble vitamins, including vitamins A, D, E, and K, are generally more toxic and represent the greater of well-defined toxidromes. The following is the recommended daily allowance or the daily goal of intake for vitamins. Failure to consume a vitamin's RDA for prolonged periods will be manifested as the clinical syndromes of vitamin deficiency. Consequently, the chronic consumption of vitamins in doses exceeding the RDA become manifested as clinical toxidrome known as hypervitaminosis. The fat-soluble vitamins. Vitamin A. Vitamin A or retinol is necessary for the normal performance of the retina and for growth and differentiation of epithelial tissues, as well as in reproduction and bone growth. The presence of excess vitamin A will exceed the capacity of retinol-binding protein. Free vitamin A then non-specifically binds to plasma proteins and is delivered to peripheral tissues where it enacts tissue damage by producing unstable cellular membranes through generation of free radicals. In acute overdosage, headache, nausea, vomiting, and irritability may be present. Chronic toxicity may occur after ingestion of 25,000 IU per day for 8 months, with papilledema, diplopia, headache, muscle stiffness, weight loss, pruritus, hair loss, hepatomegaly, splenomegaly, and nasal and oral bleeding. Supportive measures must be undertaken as the primary treatment along with discontinuation of vitamin A use. Gastric decontamination may also be done with activated charcoal following acute ingestion. In cases of increased intracranial pressure, mannitol 0.25 to 1 gram per kilogram intravenously repeated every 5 minutes as required. And steroids such as dexamethasone 0.15 mg per kilogram IV followed by 0.25 mg per kilogram per day every 4 to 6 hours for 5 days may be administered. Moreover, blood pressure, fluids, electrolytes, and central nervous system status are monitored during treatment. Vitamin D. Vitamin D or calciferol can be found in food and synthesized by the body after being exposed to ultraviolet rays from the sun. Its main function is to maintain normal blood levels of calcium and phosphorus. It aids in the calcium absorption, helping to form and maintain strong bones by promoting bone mineralization. Vitamin D toxicity is usually associated with the treatment of hypoparathyroidism and with wrong use of megavitamins. Excess vitamin D results in hypercalcemia, hypercalciuria, decreased fecal fat, and accelerated deposits of calcium in soft tissues. Its primary presenting symptoms are anorexia, polydipsia, weakness, nervousness, and pruritus. Discontinuation of the vitamin is the primary treatment along with provision of a low-calcium diet. Severe hypercalcemia may be treated with prednisone 1 mg per kilogram per day, calcitonin 4 to 8 units per kilogram every 6 hours, and mithramycin 50 microgram per kilogram. Vitamin E. Vitamin E is a major lipid antioxidant in cell membranes. It prevents free radical attack on polyunsaturated fatty acids in membranes. The excessive intake of vitamin E may result to depletion of vitamin A supply and contradict the function of vitamin K, thus inhibiting prothrombin production. When taken in high doses, nausea, muscular weakness, fatigue, headache, and blurred vision may result. Its chronic use may produce gonadal dysfunction, creatinuria, and gastrointestinal upset, but gradually disappears when discontinued. The normal range of vitamin E levels is 0.5 to 2 mg per deciliter, and any value exceeding these levels indicate overdosage or toxicity. Treatment is primarily discontinuation of the large doses of vitamin E and supportive therapy. Coagulation deficits should be managed with intramuscular vitamin K. Vitamin K. Vitamin K or phytonadione is used in the production of prothrombin. It is useful for treating hypoprothrombemia and hemorrhage brought about by the overdosage of oral anticoagulants. It is readily absorbed in the gastrointestinal tract and stored in adipose tissue. Vitamin K oral administration will decrease prothrombin times within 12 to 48 hours and 3 to 8 hours when administered parenterally. Hemolysis and hyperbilirubinemia following administration of vitamin K may suggest diagnosis of vitamin K overdose. Immediate discontinuation of vitamin K must be done, and liver function tests must be obtained. Anaphylactic reactions may require administration of epinephrine and histamine blockers. The water-soluble vitamins. Vitamin C. Vitamin C or ascorbic acid is an essential dietary nutrient used to prevent scurvy, facilitate wound healing, and recovery from extensive trauma, and treat common cold. The mechanism of homeostasis attempts to eliminate the unnecessary quantities, and it has been found to increase the excretion of oxalate, leading to renal calcium oxalate stones. The primary symptoms, nausea and diarrhea, are attributed to osmotic load of excess vitamin in the intestine that resolves upon discontinuation of the drug use. Evaluation of the urine may show oxaluria, uricosauria, and hemoglobinuria. Complete blood count may also be initiated if hemolysis is suspected. Symptoms usually resolve in hours upon discontinuation, and hydration may also be necessary to prevent renal oxalate deposition. Vitamin B1. Vitamin B1 or thiamine is an essential cofactor in a number of enzymatic reactions and is necessary for ATP and DNA synthesis, carbohydrate metabolism, and nerve conduction. An excess administration of thiamine saturates the tissue stores and the excess is excreted renally as intact thiamine or its metabolites. Anaphylactic reactions have been observed in individuals receiving thiamine parenterally that result into hypotension, angioedema, and weakness. Treatment includes rapid infusion of crystalloids and administration of epinephrine and histamine blocking agents. Vitamin B3. Vitamin B3 or niacin is converted to either NAD or its phosphate, which are vital coenzymes for various enzymes involved in redox reactions, essential for tissue aerobic metabolism. Primarily, niacin toxicity can be ascribed to chronic therapeutic use of large doses of nicotinic acid as a lipid-lowering agent by inhibiting synthesis of very low-density lipoproteins. Chronic overdoses result to myopathies manifested by leg myalgias and cramps. Laboratory findings may show elevation in aspartate aminotransferase, alanine transferase, bilirubin, and lactate dehydrogenase levels. Discontinuation of the vitamin is the most important therapy in niacin toxicity. Aspirin is also used to counteract the flushing experienced with niacin use, while hepatotoxicity requires supportive therapy. Vitamin B6. Vitamin B6 or pyridoxine is involved in the transamination of amino acids and conversion of tryptophan to niacin. This is also essential in the synthesis of GABA within the central nervous system. Pyridoxine toxicity is most likely to occur with chronic ingestion of more than 500 milligrams per day, often used for premenstrual syndrome. The ingestion of 6 grams daily for prolonged periods has resulted in chronic neurotoxicity manifested as paresthesias, ataxia, perioral numbness, loss of position and vibration sense, sensory neuropathies, and photosensitivity. Measurement of plasma coenzyme form, pyridoxal phosphate, and total vitamin B6 levels are included in assessing vitamin B6 status. Treatment is only limited to cessation of vitamin B6 supplementation and no antidote is available. Healthy adults consuming a well-balanced diet do not require vitamin supplementation. However, vitamins are popularly believed to be a panacea and are commonly taken in mega doses. Because the therapeutic index is large, toxicity generally does not develop unless very large doses are taken for sustained periods. Physicians should consider hypervitaminosis in the differential diagnosis when patients present with symptomatology consistent with a vitamin toxicity syndrome. A thorough history with emphasis on diet and prescribed and supplemental vitamin use is important.
Do you always forget to take your food supplements? Do you always wonder if there is really need to take them? Are they really effective? Will it be bad if you take too much of it? Have you experienced some adverse reaction after taking it? These questions have always been roaming around your minds. Better stay for a while and watch the following clips. This instructional video aims to give you a better understanding of the nature of food supplements. It will give you a general explanation on how a nutritional supplement works in your body and the negative effect it may leave after taking too much of it. A dietary supplement, also known as food supplement or nutritional supplement, is defined under the Dietary Supplement Health and Education Act of 1994 of the United States of America. It is a product that is intended to supplement the diet, and it contains vitamins, minerals, herbs or other botanicals, an amino acid, a concentrate, metabolite, constituent, extract or combination of any, and a substance is historically used by man to supplement the diet. The most common nutritional supplements contain fulimarine, chromium picolinate, vanadyl sulfate, spirulina, glutathione, and glucosamine. Likewise, the most common food supplements that will derive from herbs and other plants are Nomordica chirantia, also known as ampalaya, evening primrose oil, psyllium fiber, Chinese angelica root, ginkgo biloba, The berry extract, Siberian and Korean ginseng, Bacopa monnieri, and Moringa oleifera, commonly known as malunggay. Their food supplements had been commercially sold to the public as a supplement to our personal daily diet. Taking too much of it can lead to adverse reaction toxicity, or much worse, leads to a more severe poisoning. You must always remember that anything too much is bad to our health. The law does not require nutritional supplements to be proved safe and effective prior to sale if there are no labeling drug claims. These are such claims to diagnose, cure, treat, mitigate, prevent disease, or affect structure or function of the human body. The purity of available products has not been evaluated. In specific sources of food supplements, trivalent chromium-3 is commonly found in nature and is considered an essential trace element in biologic systems. Trivalent compounds are generally poorly soluble and of low toxicity compared with hexavalent chromium-6 compounds. In chromium picolinate, chromium-3 is chelated by picolinate, an isomer of niacin claimed to enhance the absorption of chromium and to lower cholesterol. Although deficiency is unlikely and supplementation has not been demonstrated to have any consequence in normal individuals, chromium-3 is purported by its boosters to enhance glucose utilization and increase lean muscle mass. For toxic doses, chromium-3 toxicity is unlikely with a single acute dose. Gastrointestinal absorption of trivalent chromium is estimated to be less than 1%. Increased bioavailability with chelation to picolinate is not established. The minimum daily requirement for chromium has not been established, but 50 to 200 microgram is estimated to be a safe and adequate daily dose. Another source is vanadium, which is an ubiquitous non-essential trace element found in biologic systems. It occurs in 6 oxidation states, including pentavalent vanadium, which is used industrially and forms an irritant gas, and tetravalent vanadium, which is currently investigated in diabetic rats for purpose insulin-like effects. Tetravalent vanadium is poorly absorbed from the gastrointestinal tract, binds reversibly to transferrin, and is eliminated through the kidneys. The consequences of dietary supplementation are unknown. As a bodybuilding agent, tetravalent vanadium sulfate is promoted as an insulin enhancer to increase lean muscle mass. For toxic doses, the estimated average daily dietary intake is 20 micrograms. Oral ingestion data are not sufficient to establish minimum risk levels of vanadium sulfate. Ammonium vanadium tartrate, another tetravalent vanadium compound, produces gastrointestinal symptoms with daily doses of 50 to 125 milligrams. For clinical presentation, excess supplementation of vanadium sulfate in humans has not been evaluated. Volunteers given doses of 50 to 125 mg per doses of ammonium vanadium tartrate reported green tongue, intestinal cramps, diarrhea, and black stools. Another example is spirulina, a blue-green algae promoted for its amino acid content, often contains niacin. It can produce a typical niacin flushing reaction owing to histamine release, which is often alarming to the unexpecting user. Herbal teas and medication may contain variable amounts of active or poisonous substances. Homeopathic medicines are usually extremely diluted and toxicity is rare. On the other hand, naturopathic medicines or steep teas may be highly concentrated. In addition, commercial packaged products may contain multiple different herbal and mineral products in various concentrations. Nutritional supplements may contain toxic plants or herbal medicines. Contamination or adulteration with the labeled substances may also be present. You can see now a table showing the different herbs that are used as a food supplement and their known toxicity. One common clinical presentation of food supplement toxicity is liver toxicity. Overloading the liver with toxins from supplements, drugs, diet, water, and other natural substances can cause the liver to become toxic. When the liver has too much to remove and cannot keep up with the demand, it stores destroys the toxin in fat or allows them to pass into the bloodstream. Signs of liver toxicity may include body aches, flu-like symptoms, low-grade fever, pain in the right side of the chest, fatigue, headache, and edema. In the diagnosis of food supplement toxicity, urine screens are an effective way to determine the toxicity of food supplements. Serum chromium levels are not routinely available and would not be effective in determining small changes caused by chronic supplementation. Normal serum chromium is 0.04 to 0.35 microgram per liter. Normal urine excretion averages less than 10 microgram per doses. Serum vanadium levels in normal persons are 2 to 4 microgram per liter but are not routinely available. Normal urine excretion averages less than 8 microgram per doses. Other useful laboratory studies include for patients with gastroenteritis, CBC, electrolytes, glucose, BUN, creatinine, and urinalysis. If hepatotoxicity is suspected, also obtain liver transaminase and prothrombin time. For the treatment of different food supplement toxicity, most ingestions cause symptoms or only mild gastroenteritis, and patients recover quickly with supportive care. For emergency and supportive measures, maintain an open airway and assist ventilation if necessary. Administer supplemental oxygen. Treat coma, seizures, arrhythmias, and hypertension if they occur. Replace fluid losses caused by gastroenteritis with intravenous crystalloid solutions. Patients with niacin-related flash from spirulina may benefit from diphenhydramine. For pre-hospital patients, administer activated charcoal if available. Ipecac-induced vomiting may be useful for initial treatment at the scene if it can be given within a few minutes of exposure. For hospital patients, administer activated charcoal. Gastric emptying is not necessary if activated charcoal can be given promptly. Dietary supplements can offer significant health benefits. However, not all supplements are created equal, and this is why there has been so much controversy surrounding the issue. As a result of the 1994 Dietary Supplement Act, health supplements are not regulated, and as such, manufacturers do not have to guarantee the safety or efficacy of their products. This has led to many unscrupulous marketers selling nutritional supplements that not only do not offer any health benefits, but could actually be harmful to your health. This is why it is always so important to find high-quality dietary supplements.